I got 9 o'clock. I'm gonna go ahead and call the meeting to order for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning.
Good morning.
Next is approval of today's agenda.
Motion to approve the agenda.
I'll second that.
Been moved and seconded. Any discussion? Hearing none, all in favor say aye.
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 Motion carries. Now is approval of the minutes of 8/20/2025.
Lance, I make a motion to approve the minutes as presented.
I will second it.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Motion carries. Now is approval of claims for payment of 8/27/2025.
I make a motion to approve.
I'll second that.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Motion carries. Now we have is the first vote on resolution 2025-25.
Lance, I'd make a motion to approve the resolution 2025, and it reads, whereas emergency medical services are a vital component of public health and safety in Hardin County, providing critical care, rapid response, and life-saving interventions for residents and visitors alike. And whereas EMS providers in Hardin County face increasing challenges, including rising service demand, workforce shortages, recruitment and retention difficulties, and funding limitations, particularly in rural communities. And whereas the health and safety of over 16,000 residents of Hardin County depend on reliable and timely access to EMS, regardless of geographic location or time of day. And whereas pursuant to Iowa Code 422D and other applicable statutes, counties are authorized to declare EMS as an essential service and pursue voter-approved sustainable funding solutions. And whereas an inclusive, transparent, and collaborative planning process is necessary to ensure community representation, accountability, and the long-term effectiveness of EMS in Hardin County. Now therefore be it resolved by the Hardin County Board of Supervisors. Number 1, declaration of EMS as an essential service. EMS are hereby declared an essential service in Hardin County. And number 2, state level communication. Certified copy of this resolution will be submitted to the Iowa General Assembly, the Governor's Office, and the Iowa Department of Health and Human Services to support broader efforts to designate EMS as an essential service statewide.
Is there a second?
I'll second it.
It's been moved and seconded. Any discussion? This is just the first vote. It takes 3.
Yep.
Any other discussion? Hearing none, roll call.
BJ.
Aye.
Aye.
Aye. Motion carries. Now I have 9:02. I'm gonna go ahead and open the public hearing. Number 2 on the proposed resolution declaring EMS as essential service in Hardin County.
Lance, I just had a couple things. I know last week, someone asked for, kind of a asset inventory and kind of what services are available in Hardin County. So in the back, there are some copies of the non-transport agency. So I'll just read those off so people that watch us later. So Buckeye has a first responder group that's non-transport. New Providence has a first responder group that is non-transport. Steamboat Rock has a first responder group, non-transport. Ackley, as of yesterday, has a first responder EMR, non-transport. Alden has a first responder group, non-transport. Then Eldora has 2 units, paramedic level, 1 staff full-time, second based on availability. Iowa Falls has 5 units, paramedic level staffing, 2 are staff full-time. The rest are based on availability. Union has 1 EMT basic. It's all volunteer. Hubbard has 1 EMT basic transport service, volunteer. Radcliffe has 1 EMT basic, all volunteer. And so Sarah Robinson, our leader over in dispatch, sent the note, since Union, Radcliffe, and Hubbard are all volunteer based and cannot guarantee coverage 24/7, either Iowa Falls or Eldora is paged with them on calls to ensure full response capability. So I just wanted to bring that back to everybody so they had a baseline of where things stood today with human and capital resources.
Okay, so verified publication, before we skip that, we have a publication up here to be verified. It was posted. Yeah. Nope. Was up here a second ago. Yeah, they're there.
Yeah.
Anybody wants to see them? They're here.
And then the written comments that have been submitted are in the blue notebook. Anybody can look at those comments. So Donna, if you want to review those, they're here for the public to view.
Has everybody signed up for public comment that wants to speak? And let's read them on.
Miley. Carter, yep. Let me make.
Yes, please.
Miley Carter from Eldora. I have put the last 32 years of my life into public safety. 30 of us as a paramedic, 20 of us as a full-time paramedic, but starting at the volunteer level. I think one of the things that's really important to see as we move toward declaring emergency medical service as an essential service. And this, I will get to the last meeting, but I think one of the things that's really important to note is the people, yes, every town has EMS, but there's two towns, Iowa Falls and Eldora, who are covering the cost of 100% of the paramedic services. That's the highest level. Those are the only two towns that provide paramedic services for this county. As a taxpayer in Eldora, as a taxpayer in Iowa Falls, for those who would be, I'm not sure that I'm happy with the fact that my taxes are 100% going for everybody else in this county to have that service. Because of that, I hope this continues to go down the path of getting this approved as a public service, as an essential service, to more equally share the cost of what it is costing. I know what the cost is. I'm also on the city council in Eldora. I know the cost for us loss is about $300,000 a year. I would guess it's at least that or more for Iowa Falls. That's a hard thing to pay. That's a hard thing to accept as a taxpayer. So I just want to put in my positive vote for declaring this an emergency service.
All right,
Thank you.
thank you.
Next one.
John Schmitz.
Hi, everyone. My name is John Schmitz. I live here in Eldora. I'm a retired Army veteran, served as engineer. During that time, I served during the Gulf War. And because of my time in service, I have disabilities where I've had to call EMS multiple times since I've lived here. That being said, I think a lot of people, for obvious reasons, are concerned about the cost involved. Nobody wants to see their tax go up. But I did just a little bit of research. It does cost money. The average house in Hardin County, now I know there's more to it than I'm just gonna go, but if you're gonna buy a house and if you're a homeowner, I don't know all the breakdowns. This is just one example. $140,000 in Hardin County, give or take, is roughly the average cost of a home in Hardin County. At 75 cents, and correct me please if I'm wrong, because I could make a mistake here. If it's 75 cents per thousand, that equates to what, $105 a year out of your pocket? Do I have that right? I think I do. If I'm mistaken, I apologize. And you break that down further, breaks down to under $10 a month, which what, three beverages a month of your choice, 3 sodas a month is what it would cost. So it's minuscule in the scope of things. It is a tax, but the bottom line is when the next tragedy occurs or the next horrific thing, heaven forbid something happened to our high school farmer, so on and so forth, needs that help with a loved one. You have to keep in mind the very, very small amount of money that it costs to have EMS as an essential service. And again, The essential part simply means that it would become a funded, guaranteed service. As I stated before, here, the city, I know, is making things work with what they have, and I appreciate that. But the bottom line, it is currently not a guaranteed service. We have a lot of volunteers and people are getting paid. But in the scope of things legally, it is not guaranteed by these men and women. If the committee and move forward and make it a guaranteed service, and they said, yes, we've got all the information we've collected from whoever's chosen to be on the committee. The committee presents the information to these folks, and they say, yes, we're gonna move forward with a vote. I would ask that everybody keep in mind that the minuscule amount of money it costs out of your personal pocket, and I know everybody's situations vary, but we're talking about every living person within our Hardin County. So please keep that in mind when you're thinking about things. It just creates a much more stable environment for our Hardin County, the 16,000 people, okay? Nobody's more important than the next. We all have our different roles, but everybody's just as important as the next. We all put our one pant leg at a time. So again, less than, a few bucks out of your pocket a month. So, and again, I know this varies, but that puts it in a nutshell. Thank you, everybody.
Thanks, John.
Thank you.
Thank you.
Connie Perry.
Good morning.
Good morning. Morning, Connie. Good morning. Morning, everyone. My name is Connie Perry. I am a fourth generation resident in Hardin County, and I've lived here all of my life. I've raised 3 sons along with my husband Steve, south of New Providence, and we now have 5th and 6th generations growing up in this county. Our family has been of service to this county for many years, and we've also been paying taxes and supporting levies brought before us to help continue to raise our families and other families in this county. My career has been in healthcare for 52 years, caring for many individuals in need, and I've been involved at times in caring for the lives of individuals in this county as my different career paths as a nurse. That is why I'm here before you and the people of this county today. I would like to ask the people of Hardin County to not just look at themselves, but to look at everyone in this county. Look at the fact that there are many rural families that need good health care. It is a rural community, and the rural communities will suffer. We need to look at each situation as it being a life or death situation. We need to support the EMS essential services so that all people in this county receive the same care in crisis. There have been instances where calls in rural areas have delayed response times. With the funding for EMS essential services and forming the advisory committee, there would be support to work with the EMS council and assistance to the EMS system in the county by having the funding needed to assist with those services. In my research, the most hazardous industries for fatal injuries in Iowa are agriculture, which we have, forestry, fishing, hunting. We have Pine Lake right here. We have the green belt and construction, with fatalities respectively in Iowa at 23 to 26 fatalities in 2023. Those were all in rural areas. Workers in these fields often experience dangers such as heavy machinery accidents, falls, and exposure to hazardous materials. Our township, being the Providence Township, we support our local fire department. We couldn't be without that volunteer fire department. No one can. Just as we cannot be without EMS services. There is taxation levies to support the fire department, but there are no levies to support EMS in Providence Township. We presently have 4 first responders that give of their time, but do not receive reimbursement, and they do not receive funding for supplies and replacing the supplies. These first responders are on call to take care of us 24/7, 365 days out of the year. This is why the county as a whole county, must look seriously at the need for the essential service. If you live where our services are at your back door, you have a comfort in knowing someone's going to be there in seconds or minutes. But if you or a loved one are in a rural area, you could be out there enjoying a picnic or an event with friends and family, someone is injured. You want quick help. It may take 30 minutes to receive that help. Each minute of delay can decrease the odds of survival by 10%. I ask of you to put yourself out in the rural areas and think about supporting the needs for making our county an EMS essential service, so funding is available to support all EMS services in the county, so that you, your loved one, and your neighbor and friends have availability to receive care in a time of crisis. Minutes will make a difference. Thank you.
Thanks,
Thank you.
Connie.
Dr. Juber?
I only have one quick point I would like to make. EMS services are not just required by property owners. They are property owners, renters, and visitors. I would like to suggest to take that 1% sales tax first and then figure out how much more is needed and make it a levy after that. That way, property owners do share the expense, but also so do renters and so do visitors. Or even people who just pass through and have an accident. If you pass through, you're gonna buy something, chances are. So I'd like to see that 1% sales tax first to share the cost completely. Then look at levies. Thank you.
Thank you.
Thanks.
Dan. Ms. Carey. We've got their hours. Got it.
I'm Carrie Calloway Morton, for those of you that don't know me, and I was just gonna follow up and answer a couple of questions that came up at the last public hearing. Thank you for the asset assessment that you guys provided. That was one of the biggest ones. In 2022, there was a small group of us that, just as residents, took this to the EMS commission and started to talk about this. And so we did some research at that time. And on average, the call volume, meaning calls that came into dispatch, and this does include Iowa Falls. At the time, Iowa Falls was separate from Hardin County Dispatch, so we combined all these numbers. In 1 month, and this was the month of June in 2022, we had 1,828 calls across the county that required EMS service, or that EMS service was paged out for as a support for a car accident or things like that. And roughly 709 fell in Eldora, 503 fell to Iowa Falls, and 263 went to Ackley at the time. And then it went down from there. But that was one of the questions that came up, was just, how often is EMS called? And again, that's just 1 month, one snapshot. It varies, of course, and there are dual pages in there and things like that. The other thing that's important to note is that several of our EMS territories currently go outside of county limits. Iowa Falls goes north, Ackley Ackley, Eldora go east, Hubbard goes south and west. And so while this essential service tax currently under the code is a county provision, we do need to continue the discussion with the state level on looking at how do we make sure that townships outside of the county levels or outside of the county limits that are receiving services from these services can contribute as well. The other thing that I'd just like to ask the supervisors is, I know that you have all good intentions of having everybody represented on the advisory committee. But as we talked about at the last public hearing, we're getting up to about 45 people that could potentially be on that committee. And I have some concerns as to whether or not that committee could really be effective at that level. And then also, if you have a community that has 5 representatives and one that has 2, and by community, I mean townships that are contributing and things like that. How do you make sure that the decision-making process is fair and equitable? Because I don't think it can be just based on participation. So that's one thing that I would ask as we continue to move down this road that we consider a little bit. Obviously, I think that people that have an idea of what's going on in essential services should be involved, but I think there's room for people that aren't involved also, but I do think we need to look at how that's constructed and how they make decisions.
Okay,
So that's it.
all right, thank you, Carrie.
Yep.
That is all that I have got on the list.
Anybody else want to speak before get signed up? The oral comments were right there. So this was the second reading of the 2025 resolution declaring emergency medical services, EMS, an essential service in Hardin County. Last chance to talk. Otherwise, I can entertain closing the public hearing.
Make a motion to close the public hearing.
I will second that.
It's been moved and seconded. Any discussion? I'd like to thank everybody for their comments. Any other discussion? Hearing none, all in favor say aye.
Aye.
Motion carries. Public hearing is closed.
Lance, at this time, I'd make a motion to approve the second note on resolution 2025-25 as presented.
I will second it.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Roll call.
Oh, roll call.
EJ,
Aye.
Renee,
Aye.
Lance.
Aye. Motion carries. Next is consideration of approved contract for bridge replacement VROS County 42-114 5F 42H Avenue over South Park.
Yep, so this is our one on H Avenue over there, west of Buckeye, or east of Buckeye. We had 6 bidders. PCI got it again, so I'm sure you're not shocked, but second was Boulder out of Grundy Center. They're also getting more into doing complete bridges, so it's nice to have 2 companies that close fighting for the low bid.
Need to read off the other bidders. I'm just.
I think I can only read the winning bid.
Oh, okay.
but-
No, I'm not the
Oh,
number,
you
but
want the
who
number,
they
okay.
were.
Yep, so Peterson Contractors
Okay.
was your winner, Boulder Contracting second, Dixon Construction, Jasper Construction.
Okay.
Cobertson Smith Construction and Taylor Construction.
Okay,
And we've worked with Jasper and Taylor before, but I never worked with the other 2.
okay, just curious.
But yep, so I recommend approving and moving forward with this one. It'll get built sometime next year.
Okay,
Which company?
Peterson Contractors out of Rhinebeck.
PCI.
They get 95% of our bridges.
Lance, I would make a motion to approve the contract for bridge BROS CO 42 sub 114 5F 42.
I will second it.
It's been moved and seconded. Any discussion?
And you can say the price if you want. It's just the shade under $680,000
And when are they gonna start construction?
sometime next.
Next spring. Okay. Any other discussion? Hearing none, all in favor say aye.
Aye.
Aye, motion carries. Next is consideration to approve the Standard Insurance Company Group Insurance Policy Amendment.
I will make a motion to approve the Standard Insurance Company Group Insurance Policy Amendment.
I will second that.
Been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Motion carries. Now I have to change the statuses.
We got 3 of them this morning. First is for the hiring of George Van Hove as correctional officer effective August 21st, 2025 at a rate of 22.23 an hour.
I will second it.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Motion carries.
The next I have is the union negotiated pay increase for Sheriff Deputy Jeffrey Brenneman at a rate of $39.88 an hour effective September 2nd.
I will second that.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Motion carries.
The final one I have is the resignation of Ryan Shannon, correctional officer at the sheriff's office, effective August 21st. He is being paid a rate of $22.23 an hour.
I will second that.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Motion carries. Other business. Daryl.
This might be more, it's a point of order. After you close the public hearing, was there a vote on a second reading?
Yes, we took,
All right, I think that's probably void because it takes, you can't have two, can't vote twice
in the
in
same
the same
meeting.
meeting, so it might pay to make some record that that motion and.
That'll be
vote would
done.
void. It's gonna be on next week's
Okay.
agenda for the second reading, so the votes will always be 1 week after
Okay,
the public hearing, so.
okay.
It, I mean, I think it's void.
Is it
But
void
you
or
might-
should we rescind it?
Probably should by motion just
Yeah.
rescind that.
Lance, I'd make a motion rescinding my motion to approve resolution 2025-25.
Second it.
It's been moved and seconded. Any discussion? This was the second vote after the public hearing.
Correct.
Any other discussion? Hearing none, roll call.
DJ,
Aye.
Renee,
Aye.
Lance,
Aye. Motion carries. Any other business? Public comments? Adjournment.
Motion to adjourn.
I will second that.
Been moved and seconded. All in favor say aye.
Aye.
Aye. Motion carries. We're adjourned. Thank you.